Hello, JD. My name is Fatuma, your nurse. I want to go over the medication with you that the doctor has discharged you with. So I'm gonna give you the medicine that you've been taking, Synthroid, which is levothyroxine, the generic name. You take 100 micrograms by mouth every day. So you're taking this medication for the thyroid hormone replacement. You have hypothyroidism. So for this medication, you need to take it whole at the same time every day and take it 30 minutes to 1 hour before breakfast. The side effects you might feel is headache, racing or pounding heartbeat, abdominal cramps, increased appetite, muscle weakness or tremors, and difficulty breathing. Monitor You need to be monitoring the blood work, which the doctor will tell you when to do the blood work for the thyroid function test. And also, you'll also do the levothyroxine or synthroid levels periodically. The doctor will tell you when to do this test. Also, monitor your blood sugars while you're taking this medication and report the changes to the doctor. Also, report to your doctor if you're having chest pain, you're sweating, you're experiencing shortness of breath, or pounding and racing heart. The other medication that you are taking already previously is Protonix, which is pantoprazole, the generic name. You're taking 40 milligrams by mouth every day. You're taking this medication for GERD, which is the gastric reflux, basically. So this medication, you need to take it whole. Also, you take it 30 minutes to 1 hour before your meals at the same time every day. The side effects you may experience is dizziness, headache, blood vision, abdominal pain, constipation, diarrhea, nausea or vomiting, upper respiratory infection, high blood sugars level. Also, avoid excessive exposure to the sun because you may get sunburn. Report to the doctor if you're having diarrhea that does not improve, and monitor and report the side effects that do not improve over time. Also, monitor your blood sugars levels and it may increase them. So during your stay at the hospital, you had elevated blood pressure. So the doctor prescribed 2 new medications for blood pressure. The first one is Lopressa, which is the generic name is metoprolol. This medication you're taking 50 milligrams by mouth every day. So this one is for elevated blood pressure. It's best to take this medication with meals or after meals. And check your blood pressure and heart rate before taking this medication. And then after you check your blood pressure and heart rate, if the systolic blood pressure, which is the top number of the blood pressure, if it's lower than 110 or your heart rate is lower than 60, do not take it. You can call the provider's office and ask for the more guidelines, how much he wants you to. But so far, he wants you to hold it if the systolic blood pressure, which is the top number, if it's below 110 or your heart rate is below 60. The side effects you might experience on this medication is dizziness, low blood pressure, low heart rate, blurred vision, ringing in the ears, nausea and vomiting, and difficulty breathing. Report to the doctor if your blood pressure or heart rate is too low frequently or excuse me, or is too high even while taking this medication so that it can do adjustments. Also report all the side effects you're experiencing to your doctor. The second blood pressure medicine that he prescribed for you is Zestril, 10 milligrams by mouth every day, which is the generic name is lisinopril. So you're taking this one for elevated blood pressure, since your blood pressure was consistently elevated while during your admission, while you came from the emergency room out to the admission. So take this medication every day as ordered. Monitor your blood pressure before taking this medication every day. The side effects you might experience is dizziness, headache, fainting, low blood pressure, or sudden drop in blood pressure when changing position. You may also experience difficulty breathing and dry persistent cough. So for this medication, before you change position, either from sitting or from laying down, change position slowly. Like when you're going from sitting or standing, rise slowly so that your blood pressure do not drop suddenly. So always try to remember that before you change position, do it slowly. Also, you may get non-productive cough while taking this medication. So report to the doctor if you're having breathing problems, if you're experiencing abdominal pain, swelling in the face. If the side effects occur, notify the physician before you stop taking this medication. And the last medication, one of the new medication that you have is metformin, which is you taking 500 milligrams by mouth every day. This medication is for diabetes, which is elevated blood sugars. So it's best to take this medication with meals every day. And do not stop taking this medication. It is very important for you to continue taking this medication. The side effects you might experience is generalized weakness, dizziness, lightheadedness, chest discomfort, diarrhea, nausea and vomiting, abdominal discomfort, low blood sugar levels, and sweating. Report to the doctor if you are experiencing you're breathing fast, you're having muscle pain, you have dizziness, and report all the side effects. It's best to report all the side effects you're experiencing to the doctor. Also, you need to be carrying the medical identification that you're taking this medication in case of any emergency. And also do not take any over-the-counter medications like cough medicine before checking with your doctor. Not all the time. Just make sure for all your meds, before you take any over-the-counter medicine, make sure you discuss with your physician what you can take and what you cannot take. All right. So that's all I have for the medication. That's your discharge medications. And I hope you feel much better. Okay. Take care.